give me one moment. I'm just going to start the
Who's
recording.
chairing?
Same thing happened that happened to Ann. It said my battery was low, but it's plugged in.
Thank God that all wasn't recorded.
Senator Moore, we're all set. We're streaming on YouTube and the meeting is recording.
Thank you. Good morning, everyone. So I'd like to convene the meeting for Human Services for today, Tuesday, March 9th. Any remarks from the chairs?
Good morning, everyone.
Representative Case?
Good morning, Senator Moore. Senator Bertho will be a little bit late. He's in another meeting, but there are a few items we will put on consent, but one of them we have some questions on. So be prepared and we'll take care of you.
Thank you, dear. So we'll start with we're on Roman numeral 3. These are bills to be JF. Senate Bill 764, an act concerning Medicaid providers. It's a JF to the floor. Is there a motion?
Santiago.
So moved. Oh,
So
sorry.
moved.
Moved. Second.
Second by Rep. Dathan.
Thank you. Any questions? Representative Case.
Madam Chair, we're flagging this with a no. There are concerns that we discussed about, and one of the main concerns is wanting to know what the costs are. We won't know that until it goes to approach. So flagging it with a no, and I think other members are the same. If they'd like to speak up, they can.
Any questions? Thank you.
See Representative Mastrofrancesco had her hand up.
I'm sorry. Representative Mastrofrancesco.
Thank you, Madam Chair. Yeah, just a couple of concerns that I have with this. Obviously, there's a fiscal note to it. And I remember, I think it was back in 2019, we talked about this for the payment parity for nurse midwives and podiatrists performing the same services as physicians. And I love midwives, and obviously podiatrists are very important to us. But I mentioned this a couple of years ago, is that, you know, physicians spend hundreds of thousands of dollars to get their education, and I believe they should be compensated as such. So those were my two concerns, those things, the fiscal note and that issue. So I will be a no on that at this time. Thank you.
Representative. Anyone else?
Senator Moore, I don't know if you can see my hand. It's Rep. Dathan.
Yes, Representative.
Oh, thank you so much, Madam Chair. I just wanted to comment. We are voting today on the policy, from my understanding, and this bill will be going to appropriations. I was very moved by the testimony that we heard on this bill, particularly coming from the midwives. And I believe it was in Middletown that they said that they had lowered the rates of cesarean sections quite dramatically, which is a cost savings that we've seen. And so I really think that voting yes for this bill will help move the policy discussion along, and the assessment of a fiscal note will be seen as it goes to appropriations. And I know many people on this call are also sitting on appropriations. So I would like to carry on the discussion, and I'm going to be voting yes.
Thank you, Representative.
Madam Chair, just for a point of reference, this bill is going to the floor and then possibly go to appropriations. So it's up to appropriations, or whoever screens to decide if it goes to approps.
That's
comes
correct.
up for a vote. So
That is correct. Representative Wood.
Thank you, Madam Chair. I share the same questions / concerns as Representative Mastrofrancesco about doctors being compensated at the same level as midwives. I think there is a difference. However, I do strongly support midwives and further compensation from the levels they're getting now. So I'm really not sure how to vote on this. Pick a yes or a no. I do think the concerns as expressed are valid, and I would hope in approps we can figure out. I guess my question is to those on approps, and I know Representative Dathan is a vice chair there. Is this something that will be worked out, the compensation levels in appropriations?
Representative Abercrombie, you chair. Do you want to respond?
Sure. Yes, absolutely. This is something that we're already looking at in appropriations. We're looking at all provider networks. I think that you're going to see in approps that there are going to be some professions that are going to get a rate increase in the budget, and then there's going to be some grant opportunities for others. So I think that midwives is going to be one of those areas that I really believe that the parity needs to come now. It's been proven time and time again, the amount of money that they save the state, and it's really good health policy for women. And for me personally, that's what I'm basing my vote on, right? Is this a good, our job on human services is to put forward good policy, right? I'm not saying we need to be irresponsible when it comes to the fiscal, but that's another committee's lane. Our lane is to put together good policy. And I believe this is really good policy. So it will be worked out in appropriations, and I'm very excited about the approps budget this year. Thank you, Madam Chair.
Thank you, Representative Abercrombie.
Thank you. That helps a lot. I appreciate that. And I will be voting to support this at this point, given the conversations about parity for midwives. I do believe in their value. And I do think there should be differentiation with physicians, and happy to see this move forward for discussion. Thank you.
Thank you, Representative Wood. Anyone else? Shall we do a roll call vote on this? Heather?
Yes, all right. Item number 1, Senate Bill 764, an act concerning Medicaid providers. Abercrombie.
Abercrombie, yes.
Moore.
Moore, yes.
Berthel. Case.
Case, no.
Lesser.
Lesser, yes.
Garabay.
Garabay, yes.
Cabrera.
Cabrera, yes.
Sorry, Senator Cabrera, I couldn't see. Would you mind repeating that?
Sure. Cabrera votes yes.
Thank you. Butler. Cook.
Cook, yes.
Dathan.
Representative Dathan is a yes.
Goupil.
Representative Goupil is yes.
Hughes.
Hughes is a yes.
Santiago.
Santiago is a yes.
Simmons. Stallworth. Aurora.
Aurora is a no.
Buckby.
Buckby is a no.
Master Francesco.
Mastro Francesco is a no.
Wood.
Wood is a yes.
I'm sorry, Representative Wood, the camera didn't pick you up. Would you mind repeating that?
Yes, Wood is a yes.
Thank you. Thank you, Madam Chair.
Thank you. Moving on to number 2, House Bill 6318, an act concerning service animals as a JFS to the floor. Is there a motion?
So moved.
Second.
Second? It's been moved and seconded. Any
Can I,
questions?
Madam Chair?
Yes,
Madam Chair, can I just interrupt for a moment? Representative Case and Senator Lesser, can you just say your name when you say it because of the YouTube? It would be helpful. Thank you.
So moved, Representative Case.
Seconded by Senator Lesser.
thank you both. Questions? Representative Case, should we start a consent
Representative
calendar?
Buckby has a question. His hand's up.
Representative Buckby?
Thank you, Madam Chair. I think this is a great looking bill. My only concern is it bounces a little bit from dog to service animal. And is that defined anywhere in here? Is it has to be a dog? I couldn't really lay that out myself. Maybe it's just buggy eyed, but I'm concerned with, people getting on a plane with a peacock kind of thing, you know, that service animals can be any animal. I'm a little concerned with that, that'd be a service dog.
We use the term service animals, I believe. Is that correct, Kath? Representative
Yeah.
Abercrombie?
Yes, thank you, Representative, for those questions. So what this bill does is it defines, it makes us in compliance with federal law. It does not, the animals that are service animals is defined in federal law. So it changes the wording throughout this to service animals. It doesn't touch anything around emotional support animals or therapy animals. That is not in this bill at all. There was many conversations around the laws around airports and what they're allowed to do. They have a different set of rules because of the FAA, but this is purely just making us in compliance with federal law by using the terminology service animal, which is defined.
Thank you, Madam Chairman. I guess, do we, I don't know that federal law well, so do we know how that defines service animal? I mean, you know, is that really open to any animal can be a support animal?
This isn't a support animal, sir. So so anything that has to do with therapy animals or support animals is not reflective in this. This is strictly service animals, which are defined under federal law, and they are specific animals.
Thank you very much for that. With that, I definitely will support the bill. I think it's great. I just didn't have that clarification for my own my own knowledge. Thank you, both Madam Chairs.
And if I can just add to that, the S language on this, if you heard in the testimony, CHRO had some concerns about the definition of disabilities. They didn't believe that it was broad enough. They did give us language. I gave it to the advocates who I'd been working with on this bill. They said that the language was fine, that it incorporated more under the definition of disability. So that's what the S substitute language is in here. It just defines disabilities more broadly. Thank you, Madam Chair.
You're welcome. Any other questions?
Madam Chair, if you'd like to begin a consent calendar.
Thank you. We'll place this on a consent calendar.
We need to
Madam
start a
Chair?
consent calendar
And do
first.
we need a motion and a second to start the consent calendar?
Can I have a motion?
So move, Representative Hughes.
Second?
Second, Representative Dathan.
Thank you. So the
And I
first
move number
item will-
2 to consent.
Thank you. Number 3, Senate Bill 909, enact concerning changes to the Husky Bee program. There a motion?
Representative Hughes, so moved.
Second?
Santiago, second.
Thank you. Questions?
And I'll move it to a consent calendar.
Well, thank you very much, Mr. Representative Case. Number 4, Senate Bill 910, enact expanding Medicaid coverage for postpartum care to 12 months after a Medicaid beneficiary gives birth to a child. It's a
So moved.
JFS to the floor.
So moved, Representative Dathan.
Second, Senator Lesser.
It's been moved and seconded. Representative Case?
Yeah, Madam Chair, I will be a no vote on this today. I would like to see it's going to go to the floor. It's going to go to appropriations. I'd like to see what the fiscal note is on this. I don't want to give out any false hope that we're going to move this without seeing what the fiscal note is and appropriations approving it. Thank you.
Thank you. Representative Abercrombie.
Thank you, Madam Chair. Just so all my colleagues are aware, and we didn't have this information at the time of the hearing. So as of last week, the federal government, CMS, has expanded the option under Medicaid from 2 months, which is currently how we cover postpartum maternity, to 12 months with a 5-year extension. So what this bill does, the S language does, is it codifies that in the state of Connecticut, we will be expanding this option that we already cover to the full extent of the federal law, which will be 12 months and up to 5 years. We did not have that information as of the hearing. This came out with DSS in a MAPOC executive meeting last week. So for clarification, this is currently going to be accepted under federal law through CMS. So thank you,
So-
Madam Chair.
with that explanation of that federal, that still has an impact on the Connecticut budget, or is that all going to be federally covered?
It
Representative,
will be I'm sorry, Madam Chair.
go ahead. Go ahead,
Um,
Representative Abercrombie.
Our understanding is there's a potential of an increased match. Currently, there's an increased match coming of 6.2 from the federal government, which is about $150 million. They have not drilled down if there's going to be an added enhanced match under certain benefits. This may be one of those, but we don't know at this point. Through you, Madam Chair.
Representative Case, does that answer your question?
It does. We still don't have any answers financially, so I'll stick with my way if we want to go on to the other questions.
Any other questions?
There's 3 of them up there.
Is there?
Yes. Representative Massa, Francesco, Representative Rohr, and Representative Wood.
I'm sorry, I didn't see that. Representative Master Fonseca?
Thank you, Madam Chair. 2 concerns I have with this bill is one, obviously the fiscal note. And I'm just trying to understand, does the language in this bill, will this cover undocumented people here in Connecticut? Through you, Madam
Currently,
Chair.
they are not.
Representative Abercrombie?
Thank you, Madam Chair. Currently, they are not covered through this bill. Thank you, Madam Chair.
Do you have any
Thank-
questions?
Yeah, thank you. Through you, Madam Chair. So they're currently not covered. Will they be covered should this bill pass? Through you, Madam Chair.
Representative Abercrombie?
Through you, Madam Chair. Currently, they are not in this bill. Through you.
Representative Master Fonseca?
Thank you, Madam Chair. I will be a no on this today. Certainly the fiscal note is a concern. Thank you, Madam Chair, and thank you, Representative Abercrombie, for answering my questions.
Thank you. Anyone else? I don't see, I'm sorry, I'm not seeing the hands up.
Representative Wood was next.
Representative Wood?
Yes, thank you, Madam Chair. And a question about why this is going to the floor instead of appropriations. And the same sentiment holds for the bill we previously discussed. I wonder why
Representative Wood, if
that
it goes
was.
to the floor and it needs to go to approach, it'll end up there.
Right, but why did the process change in this way when it does have a fiscal note and does require appropriations conversation? Why doesn't it go directly to appropes? Why is it going to the floor? I'm just curious about the process.
Okay. Representative Abercrombie?
Through you, Madam Chair. I think that we found through the process in the past that sometimes because our timelines are so closely related that we have lost bills from the time they have gone from a committee to another committee. So we started this process a couple of years ago. Sorry, you just bounced on my screen, Representative Wood. So if I'm not looking at you, I apologize. I don't know where you went. So what we did was we changed the policy a couple of years ago that we were sending most bills, and I don't want to say all because there's always a chance, but most of them we were sending to the floor. From there, they go to the committee and they get their fiscal note. Through you, Madam. Oh, there you are, Terry. Sorry.
Yeah.
Through you, Madam Chair. That was the reasoning. We didn't want to lose any bills in the timeline of their JF deadline and ours. And I think that this year, especially with how challenging it's been with doing Zooms and things like that, I think it's even more important to make sure that the bills get to the committees and not the chance of them being lost.
So just further, I need a little further understanding of this. Will we vote upon this on the floor and then it gets referred to appropes? No, it gets sent to the floor and then referred. So by virtue of it being sent to the floor, it's automatically in the House system or the Senate system. So
Correct.
It gives it it's like we're reserving a place for it.
Exactly. If you
Okay.
recall, when we're in session, a lot of times either at the beginning of a meeting or at the end of the meeting, you'll hear someone from the majority leaders stand up and say, I refer, House Bill 909 to appropriations, right? And they'll give a list of all those bills. So yes, that's exactly how it works. And if for some reason it should have went to another committee first, because some of our bills do have to go to judicial, judiciary, sorry, not judicial.
We knew, we knew.
The screeners there will also identify it and have it go to that committee first, or if it has to go to public health for some reason, because there's so many crossover, the screening team then will refer those bills to wherever they need to go.
Okay, thank you very much. I appreciate that. I think this is good public policy. I am concerned about the fiscal note. I will be voting to support it on a policy level. However, I totally understand concerns that have been expressed about the fiscal note. So I do think it's preemptive and it should be examined further, but hold with caution. So thank you. Thank you, Madam Chair.
Thank you. I don't know if you know, but I lost you all for a couple of minutes. My computer just went out, so obviously I was not missed, and the conversation went on.
We're wayward children. You lost us all.
I
felt like we're being
Went
watched
out.
over, Senator Moore.
All right, so that was, let me just get back on track. I'm so sorry. That was
It's Representative Aurora. Senator Moore was next to ask a question.
Okay. Representative Aurora.
Thank you, Madam Chair. I would like to echo some of what my good friend and colleague, Representative Woods, just suggested, that this is indeed good policy. And, I'm very supportive. I think it's important to make sure that moms have the right care after birth. And there is nothing, there's nothing more important for a mom after that. There are many things more important, but this is very important for moms after that. But having said that, we need to make sure that we do not pass a bill which we can't pay for, or make sure that we don't give false hope, as Representative Case mentioned. So I'm extremely supportive of the idea. I think we need to make sure that whether how APROPS works, in terms of whether it's 12 months we can afford, or 9 months we can afford, or whatever we can afford. I think we need to discuss that, and new information about the federal changes are also something I want to read through myself. So while I will be voting no right now, I'm extremely supportive, and as this bill evolves and further discussion happens, I think this is an idea I certainly wish to support. Thank you, Madam Chair, for the time.
Thank you, Representative. Is there anyone else?
Senator Moore, can you see the screen? Representative Buckby is up next.
Representative Buckby.
Thank you, Madam Chair. And Madam Chair, this is kind of fun twice over. Thank you for the time on this. I kind of word for word agree with Representative Aurora on this. I definitely wholeheartedly support the concept, but the fiscal note concerns me. So I'm going to be a no on this, though I do want to read more about this myself. Thank you so much for the time.
Thank you, Representative.
That
Are
seems
there
to
any-
be everyone, Senator Moore.
Thank you. I don't know. I've got the screen up now. All right, so we'll do a roll call vote on this one, on Senate Bill 910. Heather?
Thank you, Madam Chair. Item number 4 from the agenda, Senate Bill 910, an act expanding Medicaid coverage for postpartum care to 12 months after a Medicaid beneficiary gives birth to a child, JFS, to the floor. Rep. Abercrombie.
Abercrombie, yes.
Senator Moore.
Moore, yes.
Senator Berthel. Representative Case.
Representative Case, no.
Senator Lesser.
Senator Lesser, yes.
I'm sorry, Senator, would you mind repeating that? The Zoom didn't pick you up.
Not a problem. Senator Lesser, yes.
Thank you. Representative Garabay.
Garabay, yes.
Senator Cabrera.
Senator Cabrera votes yes.
Representative Butler. Representative Cook.
Representative Cook, yes.
Representative Dathan.
Representative Dathan is a yes.
Representative Goupil,
Representative Goupil is yes.
Representative Hughes,
Representative Hughes is a yes.
Representative Santiago,
Santiago is a yes.
Representative Simmons, Representative Stallworth, Representative Aurora,
Aurora is a no.
Representative Buckby,
Representative Buckby is a no.
Representative Mastrofrancesco,
Representative Master Francesco is a no.
Representative Wood.
Representative Wood is a yes.
Thank you, Madam Chair.
Thank you. Moving on to number 5, Senate Bill 911, an act requiring the state to provide medical assistance for prenatal care. It's a JF to the floor. Is there a motion?
So moved. Senator Lester.
Seconded, Representative Hughes.
Questions? Representative Case, can this go on consent?
No, and for the same as the previous bill, a lot of things need to be figured out. It's going to go to the floor, get a fiscal note, and see where it comes out. I reserve my right to vote on the floor when the bill comes there, but I believe Master Francesco has a question.
Representative Mastrofrancesco.
Thank you, Madam Chair. Again, like the previous bill, I have concerns obviously with the fiscal note, and just the same question I asked before. Does this particular bill cover undocumented immigrants? Through you, Madam Chair.
One moment, please. It does.
This one does. Okay, thank you, Madam Chair. And once this particular bill passes, should it pass, would item number 4, Senate Bill 910 that we just voted on, would that now include undocumented immigrants?
I'm not sure of that, Representative. Does anyone know the answer to that? Representative Abercrombie is shaking her head yes.
Yes, the same policies that we put forth under Medicaid, whomever is included in that, it would be expanded, yes.
Okay, just so I'm clear, because I was a little confusing because when I asked the first question on the other one, it did not cover. I thought somebody mentioned that it did not cover undocumented.
It
because
did,
it's not
because
passed
they
yet.
weren't in the, right, they weren't in the bill.
Okay, thank you, Representative. So once this particular bill clears, if it does, then the other particular bill will include undocumented immigrants. I think that clarifies it for me. Thank you very much, Representative, for answering my questions, and thank you, Madam Chair. I will be a no on this today. Thank you.
Thank you, Representative. Senator Lesser.
Yes, thank you, Madam Chair. I don't know if it matters to Representative Mastrofrancesco or the members of the committee, but the intent of this provision is to provide the coverage to children, not to. I think that's the sort of the scope of the prenatal care is making sure that children born in Connecticut have health insurance coverage regardless of their parents' status. But that care would be provided to the child, and it's based on an Oklahoma statute that I think was the first state to do.
Thank you, Senator Lesser. Representative Wood.
Thank you, Madam Chair. I'm working to understand this as well. Right now, though, mothers are covered under prenatal care. So this legislation is specifically written without that language, though, specifically written for undocumented, correct?
Representative Lesser. I'm sorry, Senator Lesser.
That's quite all right, Madam Chair. Through you, Madam Chair. I apologize. I've got a child nearby. Through you, Madam Chair. The bill is specific for making sure that prenatal care is available. The types of situations where it might not be, are not just undocumented, where the mother is undocumented. It could include a variety of statuses. There are people who are eligible for Medicaid, and then there are people who aren't. For example, a recent arrival who is a legal immigrant might not be entitled to Medicaid in her own right, but her child, if born in the United States, will be an American citizen, and so the prenatal care would be the child without regard to the mother's status. And so that could be a recent arrival. There are a variety of different immigration types or statuses, that some of which are not eligible for Medicaid. And so it's really silent to that question, through you, Madam Chair.
So the issue I have with this is one of being clear and straightforward. I believe we have the responsibility to our constituents to always be clear and straightforward and use language exactly what we mean. And I think this is I think it's deceptive, and I don't think it's right. So while I understand, unless I'm missing something, I just really it makes me angry, quite frankly, because I have so many people saying, especially around laws, we should be clear, it should be simple, it should be compelling why we're doing it. And I mean, this is compelling. However, I'm just sort of gobsmacked that it's not more direct in the language. Here's what it covers, here's why we cover it. I believe that's our responsibility, to be very clear and straightforward. This bill isn't. I will be voting no for that reason alone. Thank you.
Representative Wood, would you like to add to the language?
Look, I have, oh boy.
I mean, if
Yeah,
you see
I
something
think
that's not, if you saw something that was not clear and we need to clarify it.
Could we pass on this for right now and let me look at it? Because thank you, I appreciate that option. And I appreciate that.
Well, we
I
can
think-
vote it and we can make adjustments once it comes out if you find something specific.
Yeah.
All
I
right.
think we should say for undocumented. I think people need to understand this is what we're voting on, and they vote in order to follow their conscience. I'm not saying you vote for or against it for that reason, but I think it should be clear that this is what we're passing. This is what we're discussing, because otherwise we're just obfuscating what we're trying to do. And I don't think that's right for the public. And I don't think it's right for our colleagues. And I will also say, I did hear some of the public hearing on this. I also have another committee that meets at 10 o'clock at the same time, and they've all been meeting, I mean, every single day. So I did miss some of this discussion. Yes.
Well, I can tell you, Representative Wood, I can tell you that the Connecticut Women in Education Legal Fund supported it. The Office of the Child Advocate supported it. The American of Obstetricians and Gynecologists, ACLU, they all supported it.
Yeah, well, there's also the other side of that.
There was no opposition to it. No one opposed it during the testimony.
I believe the language should be in there that this will be covering undocumented mothers, I guess, undocumented. I just think we should be clear. So
All
we
right.
have that information when we're making our decision on a vote. So if we could add that, I'd be happy to add that. If not, I would understand that that's the way it goes. I see a lot of hands. Oh, I've got some
I do too.
controversy.
Thank you, Representative Wood.
Yes, and I still have that other committee meeting at 10 o'clock, public hearing.
I see, as Representative Wood, if you're through, I'm going to start going through the questions. Is that okay?
Yes, I'm done. Thank you.
Representative Abercrombie.
Thank you, Madam Chair, and to my colleague and friend, Representative Wood. So for further explanation around this bill, it's not really clear that it's just undocumented. We're not sure that there's other individuals that don't qualify for Medicaid at this point that might be included in this. The other thing I'd like to say is, and this is, you know, I'm a little offended that you feel that we're misguiding the public and our colleagues on this bill. I think the bill clearly states that it's to give prenatal care to mothers who may not qualify at this point for Medicaid. And we know that most of these children will become Medicaid recipients, right? So what we're doing is We're making sure that the prenatal care of the mothers is being taken care of. The reality is this, we pay one way or another as a society. If we do not give mothers the prenatal care that they need on the forefront, these are the children that end up in CCMC, or they end up at the hospital of special care or the hospital in Boston. And what does that cost us? So for the little bit of money that it cost us to give someone insurance, I think is the right thing to do. And I don't believe that, and as a co-chair of this committee, I'm just going to say it, and you're my friend and we've worked really well together. I'm kind of offended that you think that we're trying to play a switch and bait here. That wasn't the intent at all. It's not just for undocumented individuals. It's for women that currently don't qualify for insurance, but we know that their children will become Medicaid. And it's just, in my opinion, good policy, and insurance is really important. So, that's just my comments on it. And I think that, if anybody had any language that they wanted for substitute, there was nothing talked about on this bill in screening. I think that my colleagues, Representative Case and Senator Berthel, would say that we are always open in screening to making any legislation better, and nothing came forward. So it wasn't like, we just sprung this on everyone. We have a process, and we had a public hearing, and we had the opportunity in screening to amend it, and nobody suggested it. So, in all fairness, I think it's good policy, and I would ask my colleagues to support it. Thank you, Madam Chair.
Thank you, Representative. Representative Mastro Francesco.
Thank you, Madam Chair. First, I would just like to say, Senator Lesser, that you teased us with your child there, and we didn't get to see it. Him or her? Him?
Him, yes.
Him, beautiful. And I'm enjoying watching you trying to, take care of him. I love that. Congratulations. Thank you. Thank you. Through you, Madam Chair. I'm just trying to figure out how someone would not qualify for Medicaid other than undocumented immigrants. And Representative Abercrombie, you mentioned that sometimes people may not qualify. Why wouldn't they qualify? Are they over the income threshold? Through you, Madam Chair.
Through you, Madam Chair, yes, that could be one avenue. If it's okay with you, Representative, I'd also like to give Senator Lesser the opportunity to maybe comment. This was his legislation, so he did more research, in all honesty, than I did. So if it's okay with you, Madam Chair, I'd like to turn it over to Senator Lesser.
Thank you. And Senator Lesser, we'd like to see the baby.
Thank you. I would, and I hope you don't take my my son's comments as any remark on the quality of your question. It's a good question. So, Representative, hold on 1 second, if you don't mind.
What are you doing? What are you doing?
I'm trying to get through you, Madam Chair, to Representative Mastro Francesco. So one example would be my understanding. I have to double check what the latest rules are. But if you are, let's say you are a legal immigrant, but you've been in the United States for 4 years as opposed to 5 years. If the time limit is 5 years, your child will be an American citizen. They'll be entitled to full benefits, including Medicaid. But there's a time limit on eligibility for the Medicaid program for the mother. But this care would be for the child. And I just want to speak to something that Representative Abercrombie, I thought was an excellent point, said earlier. So I looked up what the average cost of a low birth weight baby is, and that's over $200,000 per child. Whereas we're already paying for that cost. That's actually under existing law. We pay for labor and delivery for every child born in Connecticut. So if just one child that we can avoid a low birth weight outcome, that savings would pay, I suspect, for the entire cost of the program. But we'll find out more when we get to this one. It's a really important question and an important point I want to thank Representative Abercrombie.
Thank you for that answer. I'm just confused as to we're actually covering the mom. Is that correct? Through you.
No, I mean, I'm sorry. I'll turn it over to the chair.
Representative Lesser, I'm going to let Senator Lesser respond.
Yeah. So the main beneficiary of the prenatal coverage is actually the child, and that's specified in the bill. Through you, Madam Chair.
Thank you. I guess I'm confused because the child's not born yet, right? And the care is really for the mom because she's carrying the child. And I think that's where the confusion is. And I would have to agree with Representative Wood is that I just think language like this should be much clearer in my mind, that it is an unborn child. We don't, when we have medical insurance, let's forget undocumented immigrants, just people in normal. When we have a baby, our insurance covers it. We go to the doctor. It's specifically for me, right? Because I need to be healthy to make sure that my baby is healthy. I don't have, my insurance doesn't say, my regular private insurance doesn't say that you have it to cover your unborn child. It's covering me because what happens to me happens to my child. And that's where this language is confusing. It should be certainly much more clearer and absolute. And again, it kind of goes back to the bill before it. If it's covering undocumented immigrants, clearly I think it should say that. Because the child is not born yet. So I don't know how insurance would cover a child that's not born yet. And that's where the concern is. So thank you so much for answering my questions, Senator Lesser, and thank you, Madam Chair. Thank you.
You're welcome. I see Representative Hughes.
Thank you, Madam Chair. Through you, I just wanted to clear up a couple of things because the language of this bill is centering the baby's health. That's why it doesn't determine the status of the baby. You know, obviously prenatal, you're right, Representative Mastrofrancesco, but also I wanted to make an important point that the eligibility then becomes much more seamless, much more streamlined at the point of service. So a pregnant woman comes in to a federally qualified health center or to an OBGYN, then they automatically get, determine their eligibility because they're carrying a child. And that's really important because a lot of pregnant moms don't know that they're eligible for prenatal care that's covered. So they might put off going to, the doctor or getting those wellness vitamins and, folic acid and all that kind of things because they don't know that they're covered. So this pushes back up the time that baby's health prenatally is covered. And that's really important, like my colleagues are saying, for the outcomes, to especially avoid low birth weight babies and really expensive care, which we will be covering once they're born. Does that make sense? Yeah.
Representative Butler. Do you have a question, sir?
I do. Thank you very much, Madam Chair. First, I want to start off and actually give the same comments that Representative Wood gave in terms of public hearings. And when this was being debated, I'm on a committee that actually was at the same time as well. As a matter of fact, it's meeting right now. I mean, so trying to go back, well, and I know that's not just me, I know that's all of us, but I'm trying to say that there's a lot of material being covered and we just don't get to hear a sufficient amount in certain areas. And you know that it always comes up at the most inconvenient time when you really want to hear something about a certain bill. That's when the other committee is like having votes and things of that nature. So this has been kind of difficult between Human Services and Housing. They're just bumping heads, all the time. Having said that, I have a question in terms of when these women are eligible. Is it just for prenatal care? And when does it start and when does that coverage end?
Representative Lesser.
Thank you, Madam Chair. Through you to my good friend from Waterbury. And yes, the coverage would only be for prenatal care, and it would only go through at the beginning of labor, because under existing law, Connecticut already pays for labor and delivery. So that's the whole point, is that it saves money on the flip side, because labor and delivery is already covered. And so a child who has complications, is underweight, we're already picking up the tab. So this would be from the determination of eligibility to whatever the start of labor is, where the existing law already kicks in. And that would only be for prenatal care, through you, Madam Chair.
Thank you.
Okay. Okay, and I understand that, and thank you for that explanation. And I also understand the cost savings by paying upfront for the coverage versus making sure that we can reduce complications and expensive bills on the back end. That's very clear to me. I just want to, for me, I just want to make sure that this is specific to the prenatal care. And again, I guess I heard the explanation, but I just want to be very certain on when this coverage actually concludes. Is it once once the mother actually delivers the baby? Of course, the baby at that point is going to be covered. The question is, how much longer after that delivery would the mother be eligible and be covered?
Senator Lesser?
Well, this bill is only before birth. So there's a separate bill, 910, that I don't really know a whole lot about. I would defer to somebody else on the committee about, but this bill is only about prior to labor, through you, Madam
Chair. Okay, well, thank you, Madam Chair, and thank you for a chance to get some clarity. I wasn't quite clear before. I didn't hear all the debate, but the main core of my concerns have been answered to my satisfaction. So thank you very much for the answers and the opportunity to ask them.
Thank you. So I just want to say something, because senators carry 7 committees, many going on at the same time, and subcommittees. But you do have a representative that goes into all of the screenings with us and then caucus. So there is an opportunity to discuss some of those things ahead of time. And Representative Abercrombie makes herself available all the time. I have only 2 senators, but she's got several House people that you can always go to prior to seeing the bill. So I want to let you know that we don't do anything in secrecy. We do it very transparently. Representative Case and Senator Berthel, we work together to make sure that all the questions are answered while we're in screening, and that if anything comes up, you have an opportunity to ask them. So I never feel as though there's not an opportunity to ask the question. And I think that's when you don't allow questions, that's where the transparency ends. But I think we've been very open and clear on the work that we've been doing. So thank you. And I see Representative Cook's hand up. Thank you.
Thank you, Madam Chairman. I think that Senator Lesser carries 7 committees and a child at this point. I think it's important to make a statement when we talk about prenatal care, and I hear Representative Mastrofrancesco's trying to decide or dissect whether the healthcare is for the mom or the child. I think it's an extremely fine line that we get to, and I'd like to be able to explain that. So when I was pregnant with my youngest daughter, I had Crohn's disease. I weighed 97 pounds, and I was very ill. And so when I was going through the process of prenatal care and healthcare, the process that I was going through, number one, I was never supposed to be able to have children, but the process that I was going through was not necessarily for the care of myself, but for the care of the child that I was carrying. So in essence, I was just her house, and she was visiting for about 9 months. And if they did not check her birth weight, her size, her growth, I was not doing her a medical service. And so I think that as we're looking at what the difference between medical care is for prenatal versus the mom versus the child, for any of us mothers out there or the fathers that are out there, we know that it is, 9 months of back and forth. But if you have an underlying condition that can really put you as a mother in harm's way, that puts a child in harm's way, that child didn't ask for that 9 months of up and down, which may or may not have costed my daughter her life. So I think that we have a medical obligation to protect that unborn child, because at the end of the day, they didn't ask to be here, and we have a responsibility to protect them to the best of our ability. And I know that we can battle all of this technicalities, but I think it's vitally important that we look at really what's important here, and that's the health of that unborn child. And I believe that that's what we're talking about. And I'm sorry, Madam Chair, that I know we're supposed to be asking questions, but I just think it's vitally important that we take a step back and really look at the whole complex part of this, and not just who's carrying the child, but truly the health and well-being of the child. Thank you. Thank you, Madam Chair.
Thank you. Representative Wood.
Thank you, Madam Chair. Certainly, it's been a very illuminating discussion. So a couple of things. One, I totally understand the cost savings of a low birth rate. It's all about prevention. So I'm 100% on board with that. I guess I wonder, and this is a question for Marie Grady, if we're covering the unborn child, does that unborn child have a legal standing in the eyes of Connecticut law to be covered? I guess that's my concern about the lack of clarity on this.
So Representative Wood, this is an option under federal law, the Children's Health Insurance Program. This is not Connecticut law. And the previous bill, the bill extending postpartum care, that's not on its face open to undocumented immigrants. That amends the statute 17B 277, I believe, that is really only open to those eligible for Medicaid. Undocumented immigrants are not eligible for Medicaid. So I just want to make clear what the language states.
Okay, thank you. That is helpful. As far as amending the language, I don't want to do that right now, because I think we all have other committees, we all have other responsibilities, and I think we just need to move on. It's been a very good discussion. And I think my comments, Representative Abercrombie, absolutely. I mean, we've had great affection and trust and everything for how many years now. And perhaps my comments were a bit too pointed on this committee, and I didn't mean that. I mean, I did mean it specifically to the language on this bill, because I think it could have been a little clearer. In general, we're doing a lot this session, and a lot for a state that is compromised financially. So that's the bigger frustration that I have. And I don't mean that, I don't intend that for you, certainly, or Senator Moore, or this committee, because I wouldn't have chosen to be on this committee for those reasons. But I just think we have to be thoughtful about what we're doing this session. Between the virus and our financial instability, we've got a lot. And to be doing as much as we're doing, especially that are some measures that many people are asking, why are you doing it in this session? So I meant them more globally and certainly not personally. So my apologies to you for that, because I adore you. So great discussion. I don't feel the need to, I mean, I'd like to, but I don't particularly want to take the time. We all have other things to do. I still will be voting no for the reasons I mentioned. Though, again, I do believe the women should have prenatal care for their children. I mean, for the reasons we've all discussed. So end of discussion. Thank you.
Thank you, Representative Wood. I
Or at
don't
least
think
end of my comments.
Well,
You all can
I
keep
don't think
going.
it's the end of the discussion. But I do want to say, I mean, when you say we're doing a lot, but this is the place, human service is the place to do the heavy lifting, to take care of people's health. There's not, in my opinion, there's nothing more important than our health and our children and our elderly. And so if there's any heavy lifting to do or we stretch ourselves, I believe this would be the committee that we should be able to do everything we can with so many people suffering, so many people doing without, trauma that's taking place with our children. This is the place. We should be proud that we're doing heavy lifting and stretching ourselves, because at the end of the day, we pay later, if we don't take care of this in the beginning. So, Representative Abercrombie.
Thank you. And thank you, Representative Wood. And I have the highest respect for you also. We've always had a good working relationship. So thank you for that. So just for clarification, I apologize. Maybe we weren't clear in explaining this bill properly. So I'm going to take the responsibility on that. Currently, we have what's called Husky B, which is federal CHIP program, right? It's not Medicaid. It's a federal insurance plan. There is an option under that plan currently that an unborn child option, it's called. What this bill intends to do is for women that don't qualify for Medicaid, and it could be because of their immigration status, the child becomes insured under CHIP. We are one of 17 states. Currently there are 17 states that adopted this option. We're one of those states that's also looking at adopting it. So I apologize if it wasn't clear about the program that these unborn children would be going into, but this is an option under the CHIP program. I hope maybe that clears it up a little bit more. Thank you, Madam Chair, and thank you, Representative Wood.
Thank you. I don't see any other hands up.
Madam Chair.
Representative Case?
Yes, thank you. And I do think we've had some great screenings and some great questions, and more questions come out when we have committee meetings. But just to go back to what we had just talked about earlier. So if the unborn child is born, does that mother under Section 910 have those continued services for postpartum?
Senator Lesser.
Through you, I think, as I understood from comments earlier, I believe the answer is no. If 910 were to pass, which is a separate legislation, but I believe I understood from Marie that the answer would be no.
Marie, can you clarify that? Because it was stated earlier that yes, they would.
Yes, I heard that. No. So the bill extending postpartum care is for Medicaid eligible pregnant women. Undocumented immigrants are not eligible for Medicaid. The Children's Health Insurance Program, the prenatal care bill, that's a different federal program. Under that option available to states, a fetus can be treated as a low-income child, and that status of that child doesn't matter. So under the prenatal care bill, an undocumented fetus, not the mother, after labor and delivery would be covered. Under the postpartum care bill, it's only open to Medicaid eligible women, and undocumented immigrants are not eligible under federal law for Medicaid.
So the undocumented, after a baby is born, they no longer have insurance.
That's right. Yeah. Unless the state wants to provide it, but not under federal law.
Okay. But yes, we do have a very robust conversation through our screenings, and a lot of these questions come up afterwards once we're in front of our reps. So I just want to thank you all for that.
Thank you. Are there any other questions, comments? If not, we'll do a roll call vote, please.
Thank you, Madam Chair. Item number 5 from the agenda, Senate Bill 911, an act requiring the state to provide medical assistance for prenatal care. JF to the floor. Representative Abercrombie.
Abercrombie, yes.
Senator Moore.
Moore, yes.
Senator Berthel.
Senator Berthel votes no.
Representative Case.
Representative Case votes no to flag it.
Senator Lesser.
Senator Lesser, yes.
Representative Garibay.
Garibay votes yes.
Senator Cabrera.
Cabrera votes yes.
Representative Butler.
Representative Butler votes yes.
Representative Cook.
Representative Cook votes yes.
Representative Dathan.
Representative Dathan votes yes.
Representative Goupil.
Representative Goupil votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Santiago.
Santiago votes yes.
Representative Simmons. Representative Stallworth.
Representative Stallworth votes yes.
Representative Aurora.
Representative Aurora votes no.
Representative Buckby.
Representative Buckby flags with a no.
Representative Master Francesco.
Representative Master Francesco votes no.
Representative Wood.
Representative Wood votes no.
Thank you, Madam Chair.
Thank you. Next is Senate Bill 913, an act requiring fairness for I'm sorry. 913, an act requiring fairness for families and Medicaid eligibility and reimbursement determination. JFS to the floor.
Representative Hughes so moved.
Second.
Second by Representative Dathan.
Thank you. Questions?
Senator Moore, I'd like to add this or offer it to a consent calendar, please.
Thank you, Representative Case. We'll move that to the consent calendar. Moving on to number 7, House Bill 6469, an act concerning the Connecticut Home Care Program for the elderly. JF to the floor. Is there a motion?
Motion.
Representative Cook second.
Thank you. Questions? Representative Case?
Madam Chair, this is going to be going to the floor. I'd like to see the fiscal note. I'll probably flag it for until we can see the fiscal note. There's a lot of money being spent here.
Representative Abercrombie, followed by
Thank you.
Senator Berthel.
Thank you, Madam Chair. So just for clarification on this bill, this is a purely state-funded home care program. This is for our elderly that are not eligible for Medicaid. Over the last 6 years, this line item has had some huge lapses. In either 1718 or 1890, there was as much as a $12 million lapse. What we're hearing is the copay on this, which is 9% of any service that a person inquires about, that's where they're not able to afford these services. I believe that this is being very proactive. It keeps our loved ones and our seniors out of institutionalized care, which is our nursing homes, and keeps them at home as long as possible. I will say that the cost of this 9% increase will be covered by the lapse in this program. There will not be any new dollars. We can show historically that this line has been lapsing over the last 3 budget cycles, which is over the last 6 years. So I don't know if that makes individuals more comfortable with this legislation. But I just, for clarification, want people to know how I'm proceeding in appropriations around this particular legislation. Thank you, Madam Chair.
Thank you. Senator Berthel.
Good morning. Thank you, Madam Chair, and thank you, Madam Chair Abercrombie, for the clarification. I think that this certainly has merit, and I understand the intent here. But I do remain concerned, and I think that I would like to, as my good co-ranking member stated, I think I just like to flag it until we get the information back from appropriations as well. I'm not saying I wouldn't support this if it is truly I'll say a budget neutral item, and if we're able to use those lapsing funds. I know we've had a lot of conversation in our leadership meetings about various things before this committee regarding some of those lapsing funds. If we're truly in that situation, then I think I would be able to find a way to support this. But at the moment, I am going to, as Representative Case spoke to, just flag it until we get that information back and we can have that full assurance. But I do, Representative Abercrombie, I do appreciate the clarification this morning on that as well. Thank you, Madam Chair.
Thank you, Senator. Representative Case.
Thank you, Madam Chair. And, we all support the elderly, all want to work through it. My big concern is, and wanting to hear from appropriations is, yes, there is a lapse. We want to take care of the lapse, but that lapse, will it only take care of this year? What happens to next year? What happens to the following year? There won't always be a lapse in this account if we're going to be using the dollars. So I just want to hear from OFA and from our colleagues on appropriations moving forward, or is this just kicking the can down the road? Because we do have dollars in the lapse, according to Representative Abercrombie, and she's been working hard to get this covered on the 9%. What happens in the future? Where does it go?
Representative Abercrombie.
Thank you, Madam Chair. Thank you, Representative Case. So we don't do our budgets that way. Nobody has a crystal ball that says what the future is going to show. What I'm saying to you is, historically, over the last 3 budget cycles, there has been a huge lapse in this line item. So there's plenty of money in that line item to cover this lapse, which will now become the norm in the future, which means historically, we will no longer have lapse, right? So, I understand what you're saying about appropriations, but with all due respect, most of the people that are on this committee aren't on appropriations. So you guys aren't even going to see that anyways until we do the budget. So I understand what you're saying about an appropriations, but I'm sitting here telling you, as a subcommittee chair of appropriations, that there has been a lapse in this for many years, right? I think that's the best that I can tell you. And even when we do this in appropriations, OFA is not going to tell you that in the future there's going to be a problem. That's not how we do budgets. So with all due respect, we have to work with the information we have in front of you. I'm giving you the information that we have, and I can prove it through OFA. So I'll just leave it at that through you, Madam Chair.
Yeah,
thank you.
Through you, Madam Chair, and I thank you for that. And a lapse can only last as long as a lapse is there. And my concern is, we use the lapse now to cover this 9%. Going forward, what do we do? I don't want to strap anybody going forward. I don't know if this lapse can cover it year after year after year. You're correct. We're not the future legislature, but I just want to be cautious. I believe the agency or the governor's budget had cut this out. And there had to be a reason behind it, and I'd like to hear that reason. So thank you, Madam Chair.
Just for clarification, there was no cut in this line item in the budget, through you, Madam Chair. There was to another home care program, but not, this is fully state funded. This isn't, and none of these recipients are on Medicaid. This is just a helping hand for our seniors that do not qualify for Medicaid, through you, Madam Chair.
Thank you. We're all set, Representative Case?
Yes, Madam Chair. Thank you, and thank you, Representative Abercrombie.
Thank you both. Representative Hughes.
Yeah, thank you. Through you, Madam Chair, just wanted to clarify that this is a huge cost savings to the state. From the trenches, I have so many clients that apply for the home care program. They start paying for it, but they can't keep up that 9%. So they drop it, and they're dropping essential services that if we could continue them, they would stay much more vibrantly aging in place in their own homes versus precipitate falls that go to the hospital and then they have to go to a long-term care center. So it's I see it as fall prevention, honestly. It's like it's getting the services that people need to keep thriving in their own home, and so many can't afford that 9% because they're on this fixed income, and that's just eating into their medications and their utility bills and stuff like that. So that's part of why this is such an important cost savings really to the state. So I just wanted to clarify that. Thank you, Madam Chair.
Thank you, Representative. Representative Mastro Francesco, is your hand up?
Yes.
I'm sorry, it was up and then it was down. I apologize.
That's okay. Thank you, Madam Chair. Through you, Madam Chair, I'm just curious, and this may have been discussed during the public hearing, and I can't remember, I might have missed it. Do we know what the average, on an average monthly copay is for a senior citizen for this program? On an average, I know it varies. Thank you. Through you, Madam Chair.
Representative Abercrombie.
No, we don't have that figure because, and this probably isn't the right term, but this is a la carte type of system. So I'm Kathy Abercrombie. I'm in my home. I want to stay in my home. I need someone that comes in and helps me with my prescriptions. I pay 9% towards that cost. So you can't take, the cost for each person is different depending on how many services you have. Somebody might have 3 different people that come in on a weekly basis that do 3 different things. You come in and you help me with my meals, you help me with my meds, you help me bathe, right? Each of those items has a cost. I, as the recipient, pay 9% towards that. So I don't think there's a calculation per se, what each person pays. But I think Emily Shepard might be on here, our OFA analyst. Not sure if she would probably know better than me. So if it's okay with Madam Chair, if Emily, and I don't see her, but I'm sure she's on here, if she would like to comment.
I don't see Emily. I don't see her. Is there anyone else here who could speak to that?
Is our new analyst on here that works with Emily? I don't see her either.
Okay, that's fine.
I apologize, Representative.
That's okay. I just wanted to get an idea, the activities of daily living, other ADLs, are there different tiers? I'm just trying to get some crazy figure, something, just to see what they say. So I love the home care program. I love our elderly, and we all hopefully still have them hanging around and doing what we can to help them. So I am just concerned about the fiscal note, and I just wanted to get those figures. So it's not like I won't support the bill when it comes to the floor. I just want to get a little bit more information before I make that decision. Thank you, Madam Chair, and thank you, Representative Abercrombie, for answering my questions.
Thank you both. Representative Case.
Thank you, Madam Chair. So I guess some of the frustration is we all support the elderly. We all support the home care program. Why did this 9% even come into effect? Because we couldn't afford it. But we need to look to see why this 9% monthly copay came into effect. Were we in a bad fiscal time in the state?
That's what it was.
So what's to say that doesn't happen again? And what's to say this budget doesn't fall apart? I support them 100%. I don't want to give false hope that we're going to be able to get rid of this. For some reason, we shouldn't be charging any copay at any time. But why do we have a 9% copay right now? Because we couldn't afford something. So that was on previous legislatures that put this together. So we need to seriously look at that and look at our budget. And I respect Representative Abercrombie for thinking outside the box and looking at the lapses. Our administration should be looking at the lapses and saying, let's get rid of this copay, because our elderly don't deserve to pay a copay. They're in a portion of their life where they don't have the dollars. They should be out there doing the things that everybody wants them to be doing. But why is there the 9% copay? That's where I think a lot of the frustration is. That's why I want to flag it in the process, which I know we talked yesterday in screening on some other bills. It's so hard when you don't know the financial outcome. We can push bills out, but they might not make it. They might not make it out of another committee. I'd like to see what the financial impact is, but the bottom line is, where did that 9% originate from? Was it 1%, going to 2%, going to 4%? The elderly shouldn't pay anything. But for some reason, there's a 9% copay in there now, and we're going to cover it through savings that we got in the program called lapses. Thank you. All due respect, Rep. Abercrombie.
Thank you, Representative Case. I see you, Representative Abercrombie.
So, and with all due respect to my colleague, Representative Case, we have worked really well together over the years, and you were on appropriations. We've had some really difficult budgets. You know, I've been here since 2005, and we've only had in that time one budget with a surplus. And you and I both know that Human Services has always been on the chopping block. I was here back in 2010 when we did a 15% copay, and it came out to be $150 average for every senior. And we came back in special session and reversed that, because we realized that we would get nobody in the program because our seniors do not have any reserve dollars. So I understand what you're saying about copays, where did they come from? But what I will say is, in Human Services, our Medicaid program and all of the services we do are always flexible, right? So Husky, right? 4 years ago, Husky A adults went from 201% down to 160. We always make adjustments in the budget for Human Services. As far as the governor and his budget, no offense, and I've been outspoken on this, I'm appalled at what they did in the Human Services. There was no reason that we had to do these cuts in Human Services. But we're the separation of branches, right? And the job of us as a legislative branch is to have the governor come out with a budget, which he has to do constitutionally, right? And then it's our job to decide what we can live with and what we can't live with. I personally am tired of all these lapses going into the black hole of the general fund instead of going back into these programs to help people that we serve. So I'm here saying to you that historically, there have been huge lapses in this program. This year, there is more than a $5 million lapse in this program, and this program only costs us about $2 million. So not only can we help the people we represent by doing this, the governor's still going to get $3 million from that lapse line. So, you know, with all due respect, that's kind of how we do budgets. And if we wait for the day, even in the 2021 budget, none of us saw the $170 million surplus. None of us saw the $450 million lapse. And oh, by the way, the governor's office did nothing to help the people that we represent. So we have an opportunity here, and I'm taking full advantage of it. So thank you, Representative Case.
Thank you, through you, Madam Chair. I thank you, Representative Abercrombie, and I know you've been a very loud not supporter, but person going against where the Human Services are in the governor's budget. The DSS did testify that this 9% is in their budget as a copay, and that it's in the governor's budget. So that to me tells me there's work to do, which I know you'll stay up 24/7 doing the work on it, but the governors use those lapses elsewhere, and therefore those lapses need to be figured out. I mean, we have hundreds of millions of dollars that are looking to be added in. I guess the bottom line, and I'll stop the conversation here, is why is there a 9% copay at all for our seniors? It should stop because people before projects. And here we are with a 9% trying to backfill it with savings when the governor's office already spent the savings. DSS testified that the money isn't there, that we need the 9%. So it's going to be a big haul when we're pushing this budget towards the governor. So
Well, with
thank
all due
you,
respect,
Madam Chair.
with all due respect, the governor hasn't spent the lapses because we're working on the budget now. So this isn't his money. So we have the right to decide how these lapses are spent. So with all due respect, this money has not been spent because we don't even know how much of a lapse it's going to be exactly. We just have a projection at this point. So we have the opportunity to do the right thing here by our seniors, right? And it's about time we stand up and do the right thing. I've been here long enough that I am tired of these cuts to the human services. And I'm sorry if I sound angry, but I am angry. I'm tired of not doing the right thing because we keep saying we can't afford to. You know, we had an opportunity in 2021 to do the right thing. We actually still have the opportunity because that budget is still active till July 1st of this year. And we need to do the right thing. We should be taking part of those lapses out of the Medicaid and putting it back in to the nonprofits as a grant. Does that do everything? No, but it's a starting point. But nobody wants to talk about that because the governor has already spent the money. It's not his money, with all due respect. So I'm sorry if I sound angry, but I am angry because I've been working on this for over 16 years. And now we have the opportunity to do the right thing. And everybody's worried about the future. Why don't we worry about the place we're at right now? So thank you, everyone.
Representative Wood, before I do that, I want to say amen to Representative Abercrombie. Representative Wood.
Yes, amen to Representative Abercrombie. I'm with you on all of it. Thank you.
Thank you. Thank you. I want to say, Representative Kate, you mentioned that Representative Abercrombie was loud on these. Her passion and her knowledge of watching all these things transpire over 15 years and still be fighting for those same things that are just really principled and what's right. And Kathy, I love it. I keep hearing you say, do the right thing. And that's really what we should be pushing equally as hard on things that our people are counting on us equally as they push back and say, we don't have the money, right? Billions of dollars going to flow into Connecticut from the federal government. How's that money going to be used? Do we have a say in it? So everything that we can do to correct the past, we should be working on right now. So I salute you, Representative Abercrombie, and I thank you for the hard work and your fighting on these, considering that I don't know who else is on appropriations here. I know I'm not. So you have to be loud because you have to echo all of these voices for us. So thank you. So we're going to do a roll call vote if there's no other. Representative Case.
Just before, and I just want to thank Representative Abercrombie. I just want to, and I should have asked this earlier in screening, whatever. How the heck did we get to a 9% copay? It had to be over many years. I hope we can fix it and there's no copay going forward, period. So that's our goal. That's who we are. We got to be careful with these federal dollars. It's a one-time thing, and we have to make a budget so that the people of Connecticut can go forward. But thank you very much. I appreciate that. But 9% had to grow over a number of years.
Thank you. Roll call vote, please.
Thank you, Madam Chair. Item number 7, House Bill 6469, an act concerning the Connecticut Home Care Program for the Elderly. JF to the floor. Representative Abercrombie.
Abercrombie, yes.
Moore.
Moore, yes.
Berthel. Case.
Flag for no for financial.
Lesser. Garabay.
Garabay, yes.
Cabrera.
Ferrera, yes.
Butler. Cook.
Cook is a yes.
I'm sorry, Representative Cook, would you mind repeating that? I couldn't see you on the Zoom.
Representative Cook is a yes.
Rep
you.
Dathan?
Representative Dathan,
Rep Dathan votes yes.
Representative Goupil,
Representative Goupil is yes.
Representative Hughes,
Representative Hughes is a yes.
Representative Santiago,
Santiago's a yes.
Representative Simmons, Representative Stallworth,
Representative Stallworth is a yes.
Representative Aurora,
Aurora is a no.
Representative Buckby,
Representative Buckby Flags is a no.
Representative Master Francesco,
Representative Mastro Francesco flags this with a no.
Representative Wood.
Representative Wood is a yes.
Thank you.
Madam
Thank you.
Clerk, can you go back to Senator Lesser and Representative Simmons? Sorry, Caroline.
Thank you, Representative
Sorry.
Abercrombie. So Senator Lesser,
He's trying to unmute.
Senator Lesser is an aye, I believe.
would you like me to reread the motion, Senator? Did you need me to repeat the motion so you knew? Okay. Representative Simmons.
Projects.
Representative Simmons is a yes.
I don't
Thank
know.
you, Madam Clerk.
Thank you, Representative. And is Senator, I don't believe Senator Berthel is here. And Representative Butler.
Thank you.
Larry's here.
I know he, yes, I
No.
see him in the participant panel. I don't know if he can hear me.
Okay. We're going to move on to,
I'm sorry, Madam Chair. Could we hear that motion just repeated just for a second?
Absolutely. So this was item number 7, House Bill 6469, an act concerning the Connecticut Home Care Program for the Elderly, a JF to the floor.
Senator Lesser, yes.
Thank you.
thank you. Representative Butler, I don't think he's there. All right, so we're going to move on to number 8, House Bill number 6473, an act expanding the diaper bank to include feminine hygiene products, a JF to the floor. Is there a motion?
So move, Representative Hughes.
Second, Senator Lesser.
Questions? Representative Case?
Madam Chair, so as we talked about, this is, and I know Kathy and myself, we've been very supportive of the diaper bank over the years, but we've underfunded. The problem is underfunding the diaper bank, but now adding services, adding more services to it. Are we going to be able to fund it, which we did not fund it fully in the past few years? That is my concern, to add things to a program when we can't fund the program to the fullest extent that they've asked for. So I will flag this once again until we can find out the information that we can fully fund the diaper bank as been requested.
Thank you, Representative Case. So the bill actually says it's an unspecified amount to DSS. And yes, there was a cut, but we've discussed it a little bit with some people in appropriations to figure out how to put some portion of the money into the feminine products. You know,
But
I
if
was
there was a
moved by-
cut to, if there was a cut to diapers, how do we add more to the program when we're not fully funding what the actual program is about? I have nothing against adding more things to it, but we can't fund what the original mission of the program was.
Thank you. Any other questions? Roll call vote, please.
Thank you, Madam Chair. Item number 8, House Bill 6473, an act expanding the diaper bank to include feminine hygiene products, JF to the floor. Representative Abercrombie,
Abercrombie, yes.
Senator Moore,
Moore, yes.
Senator Berthel, Representative Case,
Representative Case flags it with a no for funding.
Senator Lesser,
Lesser, yes.
Representative Garabay,
Garabay, yes.
Senator Cabrera,
Senator Cabrera votes yes.
Representative Butler, Representative Cook,
Representative Cook votes yes.
Representative Dathan, Representative Dathan, Representative Goupil,
Representative Goupil is yes.
Representative Hughes,
Representative Hughes is a yes.
Representative Santiago,
Santiago is a yes.
Representative Simmons,
look at it,
Representative
and you
Simmons,
stress the
yes.
regional piece of this.
Representative Stallworth,
Representative Stallworth is yes.
Representative Aurora,
Uh,
That it can happen
Aurora,
more quickly.
excuse me, let me.
And make sure that those communications.
Aurora is a no.
And of course, while we're.
Representative Buckby,
Representative Buckby flags with a no.
Representative Master Francesco,
Representative Master Francesco flags this with a no.
Representative Wood.
Representative Wood is a no.
I'm sorry, Representative Wood, could you repeat that, please?
Representative Wood is a no.
Thank you. Thank you, Madam Chair.
Madam Clerk, can you go back to Representative Dathan?
I'd be happy to. Thank you, Representative
Representative
Abercrombie.
Dathan? Madam Clerk, you have to call her.
I'm sorry, I thought she heard you. Representative Dathan,
Okay. We'll have to go back to her after. We'll vote on the consent calendar. There a
thank you,
motion?
Madam Chair. So the items for the consent calendar are number 2, House Bill 6318, an act concerning service animals, JFS to the floor. Item number 3, Senate Bill 909, an act concerning changes to the Husky Bee program, JF to the floor. Item number 6, Senate Bill 913, an act requiring fairness for families and Medicaid eligibility and reimbursement determinations, JFS to the floor. Representative Abercrombie,
Abercrombie is yes on the consent calendar.
Senator Moore,
Senator Moore is yes.
Senator Berthel, Representative Case,
Yes. Representative Case is a yes.
Senator Lesser,
Yes. Senator Lesser, yes.
Representative Garabay, Senator Cabrera,
Senator Cabrera votes yes.
Representative Butler, Representative Cook,
Representative Cook votes yes on the consent calendar.
Representative Dathan, Representative Goupil,
Representative Goupil is yes.
Representative Hughes,
Representative Hughes is a yes.
Representative Santiago,
Santiago is a yes.
Representative Simmons,
Project.
Representative
So
Simmons is a
for
yes.
at least
Representative Stallworth,
Representative Stallworth is a yes.
Representative Aurora.
Aurora is a yes.
I'm sorry, Representative, would you mind repeating that? I couldn't see you on the Zoom.
Sure. Aurora is a yes.
Thank you, Representative. Representative Buckby,
Buckby is a yes.
Representative Master Francesco,
Mastro Francesco is a yes.
Representative Wood,
Wood is a yes.
and I will call Representative Dathan again. Representative Dathan. Thank you, Madam Chair.
Representative Garabay is here.
Excellent, thank you. Representative Garabay.
Garabay is a yes.
Thank you, Representative.
Representative Dathan is on 2 other Zooms, so I'm sure she will, since we will be leaving the votes open, I'm sure she'll vote as soon as she gets a chance. Thank you for going back to our colleagues that are trying to juggle too many things.
So the votes will remain
Including,
open till
including
1:30.
Senator Lesser.
Yeah, thank you.
Votes are open until 1:30. Is that correct, Heather?
Yes, it is, Madam Chair.
Thank you. So the next meeting is March the 16th. And there may be, the House may be going into session. So we're thinking about going in at 9 a.m. to start and breaking when you go into session and coming back in after the session's over. So we'll know more. Representative Abercrombie.
So just, we talked about this a little bit this morning in caucus. I think so that our colleagues understand, I think what we're going to be doing is Tuesday the 16th, we have the interpreters. So it's kind of challenging because of the process that we have to use. And it's the first time we've done it on Zoom. We thought that it was going to be a short session. Now we're hearing that there will be a memorial for former Senator Kane, which means that the session might be a little longer. So what we're trying to do at this point is see if we can move the interpreters to the week after, which will be Tuesday the 23rd, because we're not sure if Senate is going to go in on Wednesday the 17th or Thursday the 18th. I apologize that we can't be more concrete as to, what the dates are going to be, but we are, with all honesty, we're at the mercy of legislative management about trying to get an interpreter. So our hope is that we will be doing the public hearing that was supposed to be on Tuesday the 16th. We will be doing that on Tuesday the 23rd. We are looking at perhaps having a committee meeting next Tuesday the 16th, which will be first thing in the morning, which will give us plenty of time for us to get to Hartford in time for the session. So as soon as we know, you will know. Thank you, Madam Chair.
Any other announcements? Heather, is there anything else we need to know?
And there is still, the public hearing is on for this Thursday at 10 a.m. as well. And I believe Representative Case has his hand up.
Representative Case.
I don't know if I missed it. So is there still something going on Tuesday morning?
We might be doing a committee meeting, Jay, just to cover the bills that we have. We're still trying to see if we can do that. It's all going to depend on legislative management getting us an interpreter.
Okay, my concern just to everybody is just be careful if you're driving up and you're trying to do the meeting.
Exactly, and that's why we're thinking maybe at 9. We're supposed to go in at 12:30. I know none of us, it's not in stone yet, so if the 12:30 is still the time, we're thinking a quick committee meeting to JF Bills that should give people ample time to still get up here in time for session.
What's quick?
You can say
good
that
day.
again.
Any other questions, comments? Anybody have anything that's not clear? We'll know more probably later on in the week. All right, then we're going to recess this meeting. Senator Lesser, we really never saw the baby.
Oh, Madam Chair, I hope you heard him at least.
We
Well,
did
that's
hear
not-
him. He's
that's not enough.
hungry. He's hungry. Feed him.
All right, going to recess the meeting. Thank you, everyone.
Bye, everyone. Thank you.
Bye-bye.
Heather, did I miss a vote earlier?
Let me check, Senator. And anybody else who wishes to vote who may have missed one, if you bear with me, I'm just going to get my vote tally sheets in order to ensure that everything is covered. All right. So let's see, Senator Lesser. I think, oh, one last one, hold on. Senator, I believe you voted on all of them, so I believe you are all set.
Thank you very much.
Thank you very much. Representative Dathan? And
Go
see, I
to
also
Representative Simmons.
Yes, and I also see Representative Stallworth as well. So Representative Simmons. One of the votes is item number 1, Senate Bill 764, an act concerning Medicaid providers, a JF to the floor.
And
Yes.
I do want to
Or
apologize.
Representative
Senator,
votes
I did not
yes.
include Waterbury.
Thank
Thank
you,
you.
Representative. And item number 4, Senate Bill 910, an act expanding Medicaid coverage for postpartum care to 12 months after a Medicaid beneficiary gives birth to a child, a JFS to the floor.
Service,
Yes.
looking at
Representative Simmons
a lot
votes
of
yes.
development.
Thank you. And item number 5, Senate Bill 911, an act requiring the state to provide medical assistance for prenatal care, a JF to the floor.
I love
Yes. Representative Simmons votes yes.
Thank you very much, Representative.
Thank you all so much. I'm so sorry for missing those.
Oh, no worries.
Thank you, Madam Clerk.
Thank you. Representative Stallworth,
Yes.
good to see you. Item number 1, Senate Bill 764, an act concerning Medicaid providers, JF to the floor.
Yes.
Thank you. Oh, and also item number 4, Senate Bill 910, an act expanding Medicaid coverage for postpartum care to 12 months after a Medicaid beneficiary gives birth to a child, a JFS to the floor.
Yes.
Thank you, Representative.
All right. Thank you. Goodbye, everyone.
Bye-bye. And I see Representative Butler.
I don't know that he's
Yeah, I
and
think
also-
it's just a screen. I think
Okay,
you're
and
right.
also, all right, and Representative Dathan, I think she's also.
I
got
think
her-
Lucy is too involved with ropes right now because I've texted her twice. So we'll just let her come to you when she gets the moment.
Absolutely. Thank you, Representative Abercrombie. So,
All right, we're good. Thanks, Mayor. Great job.
thank you both.
Thank you. Talk to you
Bye.
later.
Hello, Representative Dathan.
Hello, hold on, let me pause this other thing for a second. Sorry, I'm bouncing. but
No
Did
need
you
to
get Rep.
apologize.
Butler's? I was just planning on going at the end.
I don't think, I know he's on the Zoom, but I don't think he's ready to vote either.
Okay.
So if you don't mind, I will get your votes on any items that you missed. Let me just make sure.
I know, I think the last one I voted on, was trying to.
Okay. There's so much going on, Representative. I don't know how
I
you all
feel
are doing.
bad. I'm trying to do 3 different meetings at the same time. I didn't realize our committee meeting was going to take quite so long. So I know I didn't vote on 8 and.
And the consent calendar.
Calendar, I think are the 2 I missed.
Okay, and I will just double check to
but
make sure there's nothing
Was
else I'm missing.
was 7 added to the consent calendar?
No, it's just items 2, 3, and 6. So why don't we do that first since we're
Yeah.
talking about it? So hold on, let me just grab my agenda
So
to read you the
2
full
is-
titles. 2, 3,
Yep, I
and
got 'em.
6.
Yeah, so that's House Bill 6318.
Senate Bill 909. So let me just, 6318 is a JFS.
Yep.
Item number 3 is 909, which is a JF. And item
Yep.
number 6 is Senate Bill 913, which is a JFS.
Okay, great. Yes, and I vote yes on that consent calendar.
Thank you very much, Representative Dathan. And let me, I think it's just that other item, but I want to make, yes, number
And
8
then,
is, item number 8 is House Bill 6473, which is an act expanding the diaper bank to include feminine hygiene products. And that is a JF to the floor.
yes, and I vote yes on that bill.
Thank you. And let me
And
just make sure.
I did get House Bill 7, or item 7, House Bill 6469. Is that correct?
Yes, you did vote on that, Representative. So you are all set.
Okay, great. Sorry about that. Thank you so
Please,
much.
there's no apology necessary. Thank you so much
All
for
right.
your patience.
Thanks. Bye-bye.
Take care. Bye-bye. Representative Butler, if you can hear me, I'm available to take your vote whenever is convenient for you. Thank you. Hello, Senator. It's good to see you.
Hi, sorry, I was muted. How are you?
I'm good. I'm glad that we concluded things in a timely fashion, and I
Yeah,
know
I
that
had
because
a-
everybody's got so much going on. So
Yeah, understood. I had another meeting I had to be on. Is Representative Butler on with us as well?
he's still in the Zoom, but I believe he's attending another meeting right now.
Got it.
So,
Okay. All right. So, so I think I missed all but
one
I
of them, I
missed
believe.
everything. I think I
I
missed
think
everything.
I think the only one I have your vote for so far, and let me make sure this is correct. I had you voting on item number 5, SB 911, an act
Right,
requiring the
okay.
state to provide medical assistance for prenatal care. I had you recorded as a no for
As a
that.
no. Okay. So you want to go right from the top then and just go through them?
Yeah, that would be great.
All right.
So item number 1 is item 760, sorry, item number 1, which is Senate Bill 764, an act concerning Medicaid providers, which is a JF to the floor.
Right. So I'm going to be a no.
Thank you.
Uh-huh.
Next, I'll do the consent calendar at the end.
All right.
Item number 4 is Senate Bill 910, an act expanding Medicaid coverage for postpartum care to 12 months after a Medicaid beneficiary gives birth to a child. That's a JFS to the floor.
Yeah, that, I understand that. I know it's just you and I talking and whatever, but
And
I'm gonna-
everybody on YouTube.
yeah, and everyone on YouTube. I'm going to flag that just because I think that there's I want to see, just like the conversation that you heard when I was on for the next bill. I think there's going to be a fiscal note on this that's going to need to have some consideration given to it. I think it's going to be huge. So I'm going to be a no on that with a flag for fiscal concerns.
Thank you, Senator.
You're welcome.
Item number 7, which is House Bill 6469, an act concerning the Connecticut Home Care Program for the elderly, and that's a JF to the floor.
That was the one that I was on for some of the debate, I believe, and we went back and forth, and that's when both Representative Case and Representative Abercrombie got a little animated in the debate. So I share the same concerns that Rep Case had on that. I'm just concerned about we can't look forward, but we're potentially looking forward on using lapsed funds, but we can't look forward. So I'm concerned about that we're going to make a promise this year that we may not be able to keep going forward. So I'm going to be a no again because of fiscal concerns on item number 7.
Thank you, Senator.
You're welcome.
Item number 8 is House Bill 6473, an act expanding the diaper bank to include feminine hygiene products, and that is a JF to the floor.
Yeah, similar concerns with fiscal. I'm also concerned about how this impacts the ability for the diaper bank to do the important work that it does. I think that we need to know a little bit more about this and have a larger discussion. So I'm going to be a no on that as well, Heather, for today with a flag.
Thank you.
You're welcome.
And what's remaining is the consent calendar, which is item 2, 6318, which is an act concerning service animals, a JFS to the floor. Item number 3, Senate Bill 909, an act concerning changes to the Husky Bee program, a JF to the floor. Item 6, Senate Bill 913, an act requiring fairness for families in Medicaid eligibility and reimbursement determinations, and that is a JFS to the floor.
And I'm a yes on the consent calendar.
Thank you very much, Senator.
All right. So I think that's everything.
I think that's everything. So thank
All
you
right,
so much.
Oh, you're very welcome. Did we establish a date for our next meeting?
Yeah, so the public hearing is still on for Thursday at 10.
Okay.
And because of the session, the probable session on the 16th,
Yeah.
at this point, we're probably I say we, meaning you, having a committee meeting at 9 to give people time to have the meeting and then travel to the Capitol for the session. And if
Okay.
need be, recess and reconvene after the session.
So we are going to do that as we
That
discussed.
is the plan for the committee meeting. That was initially going to be a public hearing, and I think
Right.
given the interpreters and the public, the impact on the public, the thought was to move the last public hearing to March 23rd, and that's just dependent on me being able to secure interpreters, which
And
I have a
that,
request in, and hopefully it will be fine. I haven't had a chance to check my email during the meeting.
All right, so because our last, if I'm looking at my cheat sheet correctly, the dates, our last date for a public hearing is 3/25, right?
I was looking at that too. The subject matter hearing, I think, is the 11th, and yeah, I believe that's correct. And then our
Yeah,
JF
okay.
deadline is April 1st.
Our JF deadline is April 1st. Okay, so we're
But that
talking
still
about
gives us
possibly, go ahead, I'm sorry.
No, it's my fault. It still gives the committee time to have two committee meetings on the 25th and 30th if need be. And obviously the committee can choose to meet on the JF deadline. I think that is not the goal. The goal is to wrap things up by the 30th.
Okay, so public hearing for Thursday, a quick meeting that will be recessed for committee meeting for the 16th, possible public hearing on the 23rd, and then possible committee meetings on the 25th and or the 30th if necessary.
Yes.
Okay,
Perfect.
all right, I just want to just,
Yep.
you know,
No,
it's a
and that's the
crazy
thing too.
calendar,
Like,
so.
and it's so hard because people want to know our calendar, but the session has been the perfect example that it's a constantly shifting sands, and
Yeah,
so
yeah.
so I appreciate your flexibility, and I know it's hard
Oh,
for
of course,
everybody.
and I you're very kind with that, and asking us about our availability is great as well. The only fly I'll throw in the ointment in that is that I think there's probably going to be a Senate session that gets scheduled somewhere in the middle of all of this too.
Right, and so I think and you know more than I do. So
I haven't heard anything really, but
the dates I had heard floating around were the 17th or the 18th for the Senate session.
yeah.
But if
yeah.
they move to the 23rd, I'm really in trouble.
Yeah, no kidding, right? So, all right, that's great. Well, we'll see which way the wind blows, right, on all of this. But all right, Heather, thank you so much. I think we're good, and if I think of anything else, I'll let you know. But enjoy your day.
Thank you. You too. Thanks for everything, Senator.
You're very welcome. Take
All right.
care.
Take care. Bye-bye.
Bye-bye.
Hello, Heather, are you still online?
Oh, sorry. Yes, I am, Representative. Happy to see you. I see your photograph still.
I'm sorry, I couldn't hear you.
Can you hear me now?
I can.
Excellent. Oh, good. And I can see you too. Fantastic. Thank
All
you so
right.
much for being willing to come back and record your votes.
Yes.
So I know you guys have so much you're juggling. Yep. Hold
Yeah,
on one-
especially when the meetings are at the same time.
Okay. Oh, I just realized I had the YouTube stream going, so I had a little bit of echo there. So I apologize. Would you mind repeating what you just said?
I say, yes, and these meetings are at the same time. It's like,
A lot.
Yes, and then when you get in discussions on some things that are, very detailed, it's not like you can hop back and forth. And when you do, you just miss a lot of detail that you really don't get a chance to, to get the nuts and bolts. I mean, we have a lot of concepts, but it's the language that really sometimes make you deliberate your yay or nay. But
Absolutely. Yeah, no, it's a lot. It's a lot, and you're right, because when you're going back and forth, you might have missed something earlier in the thread that would have been helpful, and that's really hard when you're not part of the entire conversation.
Yeah, and a lot of times, see, when that is going on, I can't tell you it's countless times that somebody will ask the question that you already had in mind, so you don't have to ask it.
Right.
That happens, so it's good to be able to be on, because there's a, it happens very often that somebody will ask the question that you were thinking about, and you don't have to ask it. So versus if two other people could have asked a similar question, and then you come on the heels coming from another meeting and ask the same question, and other people are thinking,
right. But they don't know, and that's the thing too, even when I'm taking the vote tally, I don't necessarily know who's on at any given point in time. And so, trying to balance out the, not waiting too long, but not rushing through to make sure everybody who's available can vote. So, so I appreciate everybody's forbearance with all of this.
No, we appreciate you. Well, I appreciate you, and really, you're I know it's not easy, so thank you for what you do.
You're welcome. As I said, you guys trying to be in multiple committee meetings and public hearings. I keep suggesting a cloning program, but nobody's listening. I don't understand. So.
Yeah, I would be all for that program.
So I have some items for you to vote on. We'll start with item number 1 from the agenda, which is Senate Bill 764, an act concerning Medicaid providers. That's a JF to the floor.
Yes.
Thank you. All right, the next, I'll do the consent calendar at the end. Item number 4 is Senate Bill 910, an act expanding Medicaid coverage for postpartum care to 12 months after a Medicaid beneficiary gives birth to a child. That's a JFS to the floor.
Wow, this is, I'm not sure about this one. We'll circle back to that.
We can absolutely come back to it. Item number 7, which is House Bill 6469, an act concerning the Connecticut Home Care Program for the elderly. That's a JF to the floor.
Yes.
Thank you. Item number 8, House Bill 6473, an act expanding the diaper bank to include feminine hygiene products. That is a JF to the floor.
Yes.
Thank you. The consent calendar is it's 3 items. Item number 2, which is House Bill 6318, an act concerning service animals, JFS to the floor. Item number 3, Senate Bill 909, an act concerning changes to the Husky Bee program, JF to the floor. Item number 6, Senate Bill 913, an act requiring fairness for families and Medicaid eligibility and reimbursement determinations, a JFS to the floor.
Well, the answer to that question has to be yes, right?
Well, no, you can vote how you choose.
No, it's consent. So, yes, I consent.
Thank you. And I already had you down for item number 5, SB 911, an act requiring the state to provide medical assistance for prenatal care. I had you down as a yes for that.
Yes,
Okay, so the last one for you to decide
yes.
is the Medicaid coverage for postpartum care to 12 months after a Medicaid beneficiary gives birth to a child.
And so, and this was where the conversation was. This is still includes the undocumented group.
That's a good question. No, because this is a Medicaid beneficiary. So they're not allowed, so people who are undocumented do not currently qualify for Medicaid, is my understanding. Once again, I'm speaking as the clerk, so to anybody who's watching, caveats. This is the clerk's understanding of it, and so it's if you wish, I mean, obviously you can vote yes, you can vote no, you can abstain, whatever you would like.
That was a good question. Yeah, I hate to, how long is the votes open?
Till 1:30.
Okay, so this is only one bill I need to go look up because I'm going to go look this up and let you know.
And Representative, I did send the substitute language. You should have received that from me. If you would like me to resend it, please just let me know.
For this bill?
Yes, this is a JFS.
Okay, and you sent it
This morning, I think around somewhere between, it was before 10, so I want to say 9-ish.
Okay. Now, if you're not doing anything, I could just check it out and.
Absolutely, yeah, no, take your time.
Like I'm looking at 9:10 this morning.
Mm-hmm.
Come on. Technology is great when it works.
I know, and then when you're waiting on it, it's taking forever to load. It's very frustrating, or worse when it crashes.
Yeah, for sure. And here we go. Okay, we're back in business. Let's see what it says. Clocking.
The little spinning circle.
Yeah, and even that isn't spinning anymore.
I'm sorry, that's got to be very frustrating.
It is, because it wouldn't take much to just decipher what I need to see, as long as I could. Meeting sub-language. Attached, please find substitute language. And I'm
There
looking
should
at
be 3 PDFs, I believe, and as I said, I'd be happy to resend if you would like me to.
No, I have, it is slow. It's like, it's clocking like crazy. I have 3 PDFs here.
Mm-hmm.
Open them. This is for 913, but that's not the bill we're talking. We're talking about 910.
Yes.
Okay, so it's not that one. Of course, it takes forever to
open each one, right? So because I use an iPad. I obviously have my work computer, but my personal use, I have an iPad. And it's been great, but now that it's 9 years old, I'm noticing all of a sudden that it's getting really, really slow. And so it's like, okay, I guess it's time to get a new one. It doesn't owe me anything at this point, but
yeah.
But yeah, I hate, it's like, I don't really, I'd really rather not buy anything else if I could help it right now, but
Yeah, it saves you the cost of a new one, which is substantial. I'm in the same area. Yeah, I have a little tablet here,
mhm,
and it's, but it helps me when I have multiple meetings that I
Right.
could actually put up and watch one while the other one is going on, but still you can't talk in both at the same time, or you
Right.
can't really hear both at the same
yeah,
time either.
I've done that actually. I've had a headphone in, earphone from one in the computer and then a different earphone from the iPad from a different meeting. So it's definitely, challenging us all in new and different ways.
Yeah, and when they're all just public hearings, you could do it, because at one point I was on I was using my cell phone and my tablet that you just saw and my laptop that we're looking at each other with now. I actually had 3 sessions at once going on.
I don't know how you keep track when it's that many going on at the same time.
Yeah, well, you do, but it's not the best scenario.
No.
But okay, I'm looking at this language. And this substitute language only has 11 lines in it.
It's so funny
Oh.
because I can't keep track of which bill has how much language, so I don't know off the top of my head.
It's okay. I'm looking at it. So the 10% under federal laws, coverage for postpartum care for women authorized eligible to the section for 12 months after so amend the Medicare plan to allow waiver as amended from time to time, which is permissible under federal law and most exemptions, and provide federal reimbursements to the state postpartum care pursuant to the section. Well, this says postpartum care for a woman otherwise eligible pursuant.
Right. They're currently Medicare recipients, Medicaid recipients. And it's just extending the coverage they already have, which is currently 3 months, and extending it to 12 months. And one of the things that was said, and once again, caveat of the clerk, giving the paraphrase, but that the federal law, there's a new language that says that that coverage can be provided up to 12 months for up to 5 years. So my understanding is that it would codify the federal law and state law.
Okay. I'll vote yes then.
Okay. Thank you. So I
All
believe
right,
that's
thank
all
you
your
for your
votes.
patience.
Oh no, thank
Yeah.
you for taking the time to read, and thank you for taking the time to come back on to vote. And I hope the rest of your day goes well.
All right, you have a good day as well.
Take care, Representative.
Bye-bye.
Bye.